And now, how can we measure the tooth mobility? The movement of the tooth can be measured simply by the handles of two instruments, and we can measure the tooth mobility in the horizontal direction. And another method for measurement of the tooth mobility is a device called a periodontometer. And another method is the periotest method or periotest device. The periotest device is measure the reaction of the periodontium to a defined percussion force which is applied to the tooth and delivered by a tapping instrument. هذا شنو الديفايس هذا بيه مثل التابينج انسترومنت في الجزء الأمامي من عنده يضرب ضربات أو بركشن على التيث حوالي بالثانية الوحدة يضرب 4 ضربات، فبال4 ثواني 16 ضربة راح ينضرب السن ويطلع لي فد فاليو يسموها البريوتست values. هذه الفاليوز this is the periotest device. The value of the periotest it's corresponding to the Miller scores. يعني هو بيه سكورات هذا التست اللي هم العلماء حسبوها من ناقص 8 إلى 50 إلى زائد 50. فكل ما يكون بالسالب يعني من ناقص 8 راح تكون التيث with no mobility، وكل ما تزيد إلى أن توصل إلى 50 راح يكون الموبيليتي is readily observed. What are the signs and symptoms of tooth mobility? First of all, the patient awareness of mobility. The patient will get attention about the mobility by the tenderness that is experienced on chewing. Also, there be a the sudden tooth displacement will cause pain to the patient during biting on food. Also, aesthetically, the tooth mobility later on will result in elongation of the clinical crown, and this will lead to the poor appearance of the teeth and aesthetic problems to the treatment of increased tooth mobility. We have 5 situations in which we will try to discuss the treatment of such a conditions. Situation 1. In this situation, we have increased mobility of a tooth with increased width of the periodontal ligament but normal height of the alveolar bone. In this condition, we can see this condition in a tooth that having improper filling or crown restorations and having high spot. This will occur an increase to tooth mobility, and exaggerated force will be applied to the crown of the tooth, and there will be a pressure and tension zone. In the pressure zone, if the force remain, it will result in bone resorption and increase in the width of the periodontal ligament space. But this is a reversible process, which means when we treat the condition and we remove this occlusal, excessive occlusal force by the occlusal adjustment, this bone resorption will be returned into bone formation and the condition will return normal. So the treatment of this situation is by the occlusal adjustment. Situation 2 of increased tooth mobility. There is mobility of the tooth with increased width of periodontal ligament and reduced height of alveolar bone. This condition can be seen when a patient receiving a proper periodontal treatment, but there is, because of the periodontal destruction, there is reduced in the height of the alveolar bone. So when the tooth is exposed to excessive occlusal or horizontal forces. The inflammatory changes will be occur, and there will be a pressure side or pressure zone. In the pressure zone, there will be bone resorption. And as a result of bone resorption, there will be increase in the width of the periodontal ligament space, and this will lead that the tooth will become hypermobile. So the treatment of this condition also is by occlusal adjustment. In situation 3, there is increased mobility of a tooth with reduced height of alveolar bone but normal width of the periodontal ligament. In this situation, there is no bone apposition on the wall of the alveoli because there is a normal width of the periodontal ligament. There is no pressure side. So, when the increased tooth mobility occur as a result of the reduced height of the alveolar bone, in this case, or this mobility, if it does not interfere with the patient chewing function or يعني comfort, or it does not disturbing the patient, so there is no treatment is required. But if the mobility disturbing the patient, so we have to do splinting. Splinting, there are many types of splints, and this condition can be used by joining the mobile teeth together by using many methods like the composite filling or fixed bridges or the removable partial prosthesis. And the splint, it is a device that is prevent motion or displacement of the mobile parts. In situation 4, a progressive increasing mobility of a tooth or teeth as a result of a gradual increase in the width of the periodontal ligament in teeth with reduced height of alveolar bone. This case occur when we have advanced periodontal disease and the destruction has been reached to a level that extraction of some teeth must be done or it cannot be avoided. When there is missing teeth in the arch, the patient or the patient will occlude on the present teeth. So the forces of mastication will apply an exaggerated force on the present teeth because there is a missing teeth, and the force will affecting on these present teeth only. This increased forces on the teeth will result in a gradual increase in the width of the periodontal ligament. And the gradual increase بالوidth مع periodontal ligament, it will result in increasing mobility or a progressive increasing mobility. In such a condition, the treatment of such condition is by only fixed splint. الفيكس سبلنت شنو اللي راح يسوي لي اياه؟ It will stabilize the mobile teeth and it will replace the missing teeth. يعني في حالة هذه السيتويشن فور أنا عندي أسنان مقلوعة هواية، معناها الفورسز اللي راح تجي على التيث الديستريبيوشن مالتها راح يكون فقط على الأسنان الموجودة، والأسنان المقلوعة بعد راحت. فبهالحالة حيصير تركيز من القوة على هاي الأسنان الموجودة، حتسبب أنه تزيد الموبيليتي لهالأسنان اللي هي باقية. And lastly, situation 5, which is increase bridge mobility despite splinting. Here in this condition, we make splints for the patient and sometimes maybe cross arch سبلنت or bridge. يعني هنا البيشنت أني عندي hypermobile teeth ومسويت له بريدج، وفي بعض الأحيان cross arch bridge أنا مسوية كل الأسنان left و right مسويت لها بريدج أو مسويت لها splinting. But despite this splinting there is mobility. مع هذا هم يعني أكو mobility. فالتريتمنت مالتي in situation 5 if it does not disturbing the patient so leave as it is. So it يعني sometimes هالmobility هذه it is acceptable by the patient and not disturbing him, and especially if the mobility is not progressively increasing. So leave as it is in this condition with this splint or this bridge. And thank you very much.